Hello students, let's understand the pathophysiology of liver cirrhosis. Pathophysiology means understanding how a disease develops and progresses. Imagine your liver as a very important organ with millions of healthy functional cells called hepatocytes. Now let's look at the first slide, the second image you sent. Step 1. Etiological factors. The process starts with an etiological factor. What does that mean? It means the cause. This could be anything that damages the liver over a long period. Common causes include chronic alcohol abuse, viral hepatitis, like hepatitis B or C, non-alcoholic fatty liver disease, NAFLD, or certain genetic conditions. Step 2. Abnormal and regenerate of cellular damage and regeneration. Because of this continuous damage from the etiological factor, the liver cells get injured. Your body tries to heal itself, so the remaining healthy cells start to regenerate or multiply to replace the damaged ones. However, this regeneration is often abnormal and disorganized. The new cells don't form in the proper structured way. Step 3. Formation of fibrous tissue. This continuous cycle of injury and abnormal regeneration leads to the formation of fibrous tissue. Think of this as scar tissue. Instead of smooth, healthy liver tissue, dense fibrous bands start to form. Step 4. Destruction and scarring. Eventually, these fibrous bands grow and spread. They start to destroy the normal liver cells, and these healthy cells are replaced by scar tissue. This is the key characteristic of cirrhosis. The liver becomes hard, lumpy, and shrunken. Now let's look at the second slide, the first image you sent, which explains the consequences of this scarring. Consequences of cirrhosis. The rigid, scarred liver tissue obstructs the normal flow of two very important things, blood and bile. Obstruction of blood flow. The liver receives a lot of blood from the portal vein. When the liver becomes scarred, this blood can't flow through it easily. This backup of blood causes a condition called portal hypertension, which can lead to serious complications like esophageal varices, swollen veins in the esophagus, and ascites, fluid accumulation in the abdomen. Obstruction of bile flow. The liver also produces bile, which is important for digestion. The scar tissue blocks the small bile ducts, causing bile to back up. This can lead to jaundice, yellowing of the skin and eyes. Final outcome, liver failure. Over time, as more and more healthy liver tissue is replaced by non-functional scar tissue, the liver can no longer perform its essential functions, like detoxification, protein synthesis, etc. This leads to the final severe stage, which is liver failure. So to summarize, a persistent damaging factor leads to a cycle of injury and abnormal regeneration. This results in the formation of scar tissue, which obstructs the flow of blood and bile, ultimately leading to liver failure.